With regard to the long-term results from weight loss surgery, we've got a number of studies. The longest running study is the Swedish SOS, or Swedish obesity study. It's been running since about 1986. They had one group of patients who had best medical therapy and another group of patients who had some form of bariatric surgery. They did different operations. They did some operations that we don't do anymore. Interestingly, the surgical group had more smokers, and the patient's average BMI was about 34, which most people would consider relatively low. That study's published serial results over the years. The Swedes are really good at population studies. They regularly get 85, 90% long-term follow-up, which is just unheard of anywhere else in the world, really. And that Swedish obesity study showed that despite the fact that the surgical group had more smokers than the non-surgical group, their cardiovascular and cancer mortality was lower than the non-surgical group. The diabetics in the non-surgical group ended up on more medication, whereas the diabetics in the surgical group less medication, and in a large number of cases the diabetes disappeared. There's been a more recent study published in The Lancet, 175,000 patients who were followed up, having had various forms of bariatric surgery, again a mixture, and that study showed that overall mortality rate was reduced by nearly 50%. To put it in a different way, if you were diabetic, your life expectancy was increased by 9 years, and if you're a non-diabetic, your life expectancy was increased by 5 years. So if we look at it from purely a medical life expectancy mortality rate, there's clear advantages from bariatric surgery. I would also say that there are clear advantages from a lifestyle point of view. So I get some patients coming in and they're not so much worried about their blood pressure or their diabetes. What they want to do is they want to get down on the floor and play with their grandchildren and not have to get help to get up. Or they want to be able to go for a walk without their knees and ankles aching. So we can look at it from both a medical and a lifestyle point of view, and I think the data is there that weight loss surgery can significantly improve medical comorbidities, but also very significantly improve quality of life. If you'd like to know any more, feel free to contact the practice. You can organise a free consultation with Shirley, the practice coordinator, and discuss your options.